What if doctors could predict the exact mental health treatment that would work for you before you even start it? Today we are diving into a powerful and fast growing topic, mental health biomarkers, and whether they could completely change the future of psychiatry. But here's the twist: despite decades of research, experts say we are still not ready to use them in everyday treatment. So, what's really going on here? For years, scientists have been searching for biological clues, things like brain activity, genes, or blood markers that could help explain mental health conditions more precisely. These are called biomarkers, and in theory, they could solve one of the biggest problems in mental health care today. Because right now, treating conditions like depression often comes down to trial and error. Doctors prescribe a medication, wait, and hope it works, but many times it doesn't. In fact, research funded by the found that only about 30% of patients fully recover with their first antidepressant. Think about that think about that for a second. That means most people have to go through multiple treatments before finding the right one. Now imagine a different future. A simple test could tell your doctor which treatment your body is more likely to respond to. No suggestion, no guesses, no wasted time. That's exactly why biomarkers are getting so much attention. According to the adding biomarkers to psychiatric diagnosis would be a major shift in how mental health care works. Experts believe it could make diagnosis faster, more accurate, and even help with insurance decisions. But here's where things get complicated, because even though the idea sounds promising, the science isn't fully there yet. The APA clearly states that biomarkers still need much stronger evidence before they can be used in real patient care. In other words, this is not a finished solution. It's still a work in progress. There are, however, some early signals that scientists are paying close attention to. For example, around 25% of people with depression have higher levels for a protein like 2 inflammation, something that can be measured through a blood test. Studies suggest these individuals may respond better to treatments that affect dopamine rather than standard antidepressants. It's a fascinating clue, but again, not something doctors can rely on just yet. And then there are the bigger questions no one can ignore. What about cost? Biomarker testing could be expensive, especially in the early stages. Insurance companies may not cover it right away, and perhaps even more importantly, what happened to your privacy if your biological data reveals your risks for mental health conditions? Some experts warn that without proper safeguards, this information could be misused. That's why specialists say this is a critical movement, not just for science, but for ethics, policy, and patient protection. At the same time, researchers like describe this as the beginning of a revolution, a sign that the current system isn't good enough and that change is coming. So, where does that leave us? Here's the honest answer. Biomarkers could transfer mental health care in the future, but right now they are still being studied. This entire discussion is based on ongoing research and expert analysis, not final medical certainty. And maybe that's the most important takeaway of all. We are standing at the edge of something big. We just haven't fully figured it out yet. Thank you.